We are talking to the chair of Rockport's Board of Health, Dr. Bruce Cohen. He is an epidemiologist and a population data specialist. Hi, Bruce. How are you?
Doing well this morning. Thank you very much for having me.
Bruce, at what point last year did you realize that this was a real pandemic and that the Rockport Board of Health was going to have an important role?
First of all, I am chair of the Board of Health, but on this morning's interview, I'm going to focus on my professional opinions. Doesn't reflect necessarily the Board of Health activities and policy, which needs to be developed in the public. So I think in February, people began to feel the impact, and things emerged early in March, and the numbers just escalated so rapidly throughout Massachusetts. It became clear that the Board of Health, not only in Rockport, but the local health departments in Gloucester and throughout the state, needed to become much more proactive. It's kind of funny because public health is known for what doesn't happen rather than what does happen. You don't hear about public health because public health is preventing disease outbreaks, preventing kids from smoking, guarding the environmental sanctity of our communities. So public health success is defined by nothing bad happening. This really switched the tables, where we and other local public health entities have to be a lot more proactive in dealing with all these new issues as they emerge.
So what was it like to be there around that table? And you can speak as an epidemiologist and not as the Board of Health director, but what was it like to be in that room and you saw this coming?
It's like watching a car crash. You know, it's a horrible event and you can't take your eyes off it. It's mesmerizing and it keeps escalating. And I think about the emergence of COVID it's a totally new disease and we have so much to learn still. Initially, we made some mistakes. We didn't think masks were essential. We didn't think children would be affected. We thought young adults would be protected. We had no idea about asymptomatic and pre-symptomatic infection. We thought this was just a respiratory disease like other coronaviruses. We thought it was acute and had no long-term consequences. So this has been an incredible learning experience where I think public health and all of the facilities in our communities have had to adapt and recalibrate as we move forward. And it really, I have to applaud Rockport and Gloucester and our neighboring communities for really pulling together, recognizing that we have to work together to address just the enormity of issues that COVID presents.
Well, Dr. Cohen, I want to ask, are you worried at all now that schools are back in session, and I think the restaurant and bar mandate is about to be relaxed beginning next week? More people are going to be allowed to sit at tables or whatever. You think that's going to precipitate a larger spike?
I'm worried about the future for a variety of reasons. It's tough to maintain continual vigilance. You know, we've been very successful so far, but there is fatigue. And as we open up, you know, the schools and try to expand businesses, there is increasing chance for exposure. We have no idea how seasonal flu will interact with COVID to precipitate more illness. Although I was reading a study today that said COVID sufferers who are also stricken by the flu have much worse outcomes than others. So Corey, I'm really concerned that we need to maintain vigilance. The virus will determine the timetable for our personal behaviors, and I think for our institutional behaviors as well. I think it's appropriate that we try to get the kids back to school, but we need to put in place the protocols and be incredibly vigilant as we move forward.
What do you think were the most important decisions the town made in terms of protecting the citizens' health and safety?
So it's not just the Board of Health, it's the entire town.
Mhm.
And I think we made some really good decisions. Certainly, we strictly enforced the guidelines that the state health department and Governor Baker promulgated. We also went beyond. I, our downtown area is incredibly congested. We wanted to welcome visitors to our community. And rather than making face coverings optional the way the state requirement is, we mandated face coverings downtown. And I think that's made us all feel more comfortable when we're visiting that commercial area. The same thing for our transfer station. This is a place where people are close together and congregate. We had no resistance in implementing stronger face covering regulations. So I think that was incredibly helpful. We've formed teams to work with the schools to develop strategies to reopen. I know in some other communities, there's been a lot of battling back and forth between public health and businesses and schools, but we are really working incredibly closely with the school communities to try to do this right. So I think we've taken a bunch of steps, and I've got to say our town manager, Mitch Vieira, has done a remarkable job. As you might know, every Monday, he gets on the phone through our reverse 911 and provides updates to the community. And my neighbors and my friends really appreciate us being as open and transparent about what we know when we know it, to share the information. I think that's a key for all local government, and particularly for boards of health. We need to be open and transparent so everyone, although they might not agree with all of our decisions, understand why we're making them.
Well, there are no active cases in Rockport right now. So congratulations.
It's wonderful, and we can't rely on past success.
Right.
Rockport is a relatively small community, and although I'm a professed data geek and love the numbers, we can't rely just on the numbers. We need to rely on common sense, and we need to rely on other activities, certainly distancing, hand washing, enforcing face coverings. There needs to be a comprehensive strategy. And the numbers are low, but we don't test. We're woefully behind other countries in our ability to test, and without that more generalized and ongoing and rapid testing, we really don't have what I think is the best information to help us make decisions. So we're doing well, and that's no cause for me to celebrate. It just reinforces the need to maintain vigilance.
Is it too hard to tell whether we've turned a corner at all?
No, it's not too hard. We have not turned a corner, and it will be a while before we turn a corner. Without comprehensive testing, without resources for PPE, without better policies that help support people who are out of work and provide childcare, it'll be a long time before we get back to any semblance of normal. We have no idea, once a vaccine is available, how long it'll take to distribute. We have no idea how long immunity will last once we do have a vaccine. There's still so much unknown for us to feel like we've accomplished something. I think is a huge policy and personal behavior mistake. We need to keep doing what we've been doing, although it is increasingly challenging. I recognize the stress it puts on individuals, on families, and on businesses. But we need to keep doing what we're doing.
Well, thank you so much. And I hope we can speak to you again, and you can keep us abreast of all your thoughts about the pandemic and more, right?
I'd be happy to. Thank you very much for having me.
Great. Thank you.